Before we move on to the transverse plane, have you got any questions to ask me on the sagittal plane and frontal plane? Did you feel the opening up and closing of the spinous process? Did you feel the opening up and then the closing of the transverse process? Do you understand what I mean about quality and then the quantity of movement between segments, between sides? You happy with that, yeah? So the next plane of movement what we're going to see is the transverse plane. Now, what you need to look at is, again, you're looking at the opening up of the transverse process, but your hand position is like your index finger pointing towards the transverse process and then the thumb pointing up. So the transverse process goes and sits at your index finger and you're trying to rotate the vertebra in that way. Do you see what I'm trying to say? So your hand goes on to the transverse process. So from the spinous process, your index finger goes on to the transverse process, and then you're going to stabilize the skull, and then you're trying to rotate the vertebra. Do you see? So you're creating the rotation between segments using your index finger. You're going to rotate your whole trunk and going to rotate through your index finger. Are you with me? So rotating towards one side, checking the quality and quantity, coming back to neutral. From there, you're rotating down towards the opposite side. So I'm going to use my index finger, place that on the two transverse process. So when I rotate down towards the left shoulder, I'm looking at the rotation of the vertebra, opening up of the transverse process on one side, and then come back to neutral, and then feeling that kind of rotational opening up of the transverse process on the opposite side. Are you with me? So it's basically your index finger goes and holds onto that kind of spinous process, pinches, and then you're creating that kind of rotational segment. You with me? Happy? Right? Joe? Jeff, can I ask you?
Oh, sorry.
If we just come further up. Catching the end.
Isabel. It's Andrew.
Just part of the dissertation go.
Right. Same as the other plane of movement, you palpate the muscles around, make sure that the muscles are relaxed. A clear communication to the patient what you're trying to achieve. And then once the patient gave the consent, and then you're going to place your hand onto so stabilize that head with the trunk, and then you place your hand onto the transverse process. So you palpate the spinous process first. Once you palpate the spinous process, can you see what I'm trying to do? Palpate the spinous process. Once you palpate the spinous process, place your index finger onto the transverse process in line with the spinous process. I'll show it again on this side. So you palpate the spinous process first. So that's a C2 spinous process. Once you palpate the C2 spinous process, place your index finger onto the transverse process. And then your thumb goes down to the mandible. So your thumb comes down and then supports onto the mandible. Is it okay? Yeah? Relax. So once you're ready, and then you're trying to create that kind of rotation, and then apply that kind of end range and feel for the opening up, then come back.
Doctor, are you using your trunk?
I'm using my trunk. That's
Feel like you're falling?
no. So if you just rotate, and then I'm just rotating, you have to use the whole trunk to rotate, and then come back. Okay? Remember, it has to be full your trunk rather than standing your trunk and rotating your whole neck. Rather than going to move, so your head, the patient's head and your trunk going to move at the same time. So place your index finger on there, stabilize the mandible, and then you're trying to create that kind of rotation. Is it okay, Joe? Yeah?
Okay.
Is it okay?
I couldn't hear a word you were
That's
saying.
fine, okay.
Yeah, fine.
And then,
Some quality footage on this video.
yeah? That's okay. And then once you palpate C2, then move on to the C3. Palpate the C3 spinous process, place your index finger onto the transverse process, and then you're trying to rotate to one side, come back. Is it okay, Joe? Then rotate to the opposite side and feel for the end feel. Then come back. Going one level below and then trying to, is it okay, Joe? Come back and then rotate onto the opposite side. So your whole trunk rotates along with the cervical spine as well. So going one level below, similarly your thumb pointing up, and then the index finger. So your hand position should be always your index finger onto the transverse process, and then thumb pointing up, stabilizing that kind of mandible, whatever the level you're palpating, and then you're trying to rotate.
Which one?
So that's index finger. Yeah.
On transverse.
Yeah. Are you with me?
Yeah.
Do you want to give it a try?
Thank you.